Join me even as I invite to come and make a presentation our sister, our friend, Dr. Jumoke Oshinaike. God bless you, man. Our Dean of Faculty of Medical Sciences of the Temple of God.
Good morning, everyone. Happy to be here again. Can I have my slides, please? So I'll be talking about substance use disorder today, / addiction. I'll start with that, and when I'm done with that, I'll then talk about depression. Substance use disorder is the same as substance abuse. It used to be called substance abuse, but we now call it substance use disorder. So, start with the definition. What is substance use disorder? It is a mental health condition in which an individual uses a substance for pleasure, despite the fact that it's causing health distress, emotional, psychological, and psychosocial distress. You have an individual who is taking something that he knows would affect his health, affect his lifestyle, and he continues to take it despite all the negative consequences of that substance. That person can't be seen as entirely normal. That person has a mental health disorder. So substance use disorder is a mental health disorder. Now, what are substances? Substances are those things that have addictive potential. Anything that you take that has a tendency of making you to be addicted to it is called a substance. And there are different types of them. You have the legal substances and you have the illegal substances. The legal substances are those that are regulated by government and they are approved for use by the public. Examples of those include alcohol, the nicotine that you find in cigarettes and other vaping and shisha, okay? And then you also have caffeine. Caffeine is an addictive substance. So when you take excessive coffee, the black coffee especially, after a while you're beginning to feel you can't do without it. You need to take it to continue to function properly. Students who are in uni would take coffee to make them awake, to be able to study at night, and it does affect them. Other legal drugs include prescription medications. There are medications that doctors will prescribe to patients who, for example, are in severe pain. There are some medical ailments like cancer patients. Some of them are in very severe pain, and the doctors will prescribe very strong painkillers for them. Also, sleep medications are also prescriptions that may be prescribed to patients, and then they use them in excess, okay? Those are also very addictive. So then you have the illegal substances. These are the ones that are not approved for use by government, and that's why if these are found on you, you are arrested and prosecuted accordingly. You have them in different forms. You have the cocaine. I think that's the powdered form. You have the crack cocaine. I think that's the one you inject. You have LSD, and you have them in different forms. The next slide, please. So they come, you have heroin, and they come in different street names, so that when they're talking about these things, nobody will know what they are talking about. Crack cocaine, for example, is called brown, and dope or something. And when these people are talking about it to themselves, people who are not informed will not know what they are talking about. Next slide, please. So substances come, the one before, please. Slide before. These substances come in different forms. They have them in tablet form, they have them in powdered form, they are in injectable forms, and you have those ones, that's cannabis, that comes like tiny leaves, nicotine there in cigarettes, alcohol. So they come in different forms and they're used in different ways. How common is substance use disorder? Next slide, please. So looking at this map, this is the map of our country, Nigeria, and the very dark green areas and the areas that are most prevalent for substance use disorder. And this is a research that was done by the World Health Organization. You have it most prevalent in the northeast and down here in the southwest. And unfortunately, the most prevalent areas are our Lagos, Oyo State, and Gombe State. Next slide, please. So this slide shows the frequency of drug use by age and drug type. If you look at this slide very closely, you have substance use disorders commonest between the ages of 25 and 39. So these are mainly the youth of the country, and they are the ones using the drug the most. And the commonest drug that is used in all the age groups is cannabis. That's the one that has the orange picture, the lowest one, cannabis, and this is followed by pharmaceutical opioids. Pharmaceutical opioids are painkillers. The commonest one that is used in our environment is tramadol. I still saw somebody in clinic 2 days ago. He's a 29-year-old young man who came and was having seizures. And he was asking me, oh, why would I be having seizures? I've never had this before. It's possible to have seizures from other reasons. But I asked him questions about every other thing. He was negative for all of that. And I just said, okay, so do you take any form of? He said, oh, well, yes, I take tramadol. Was it prescribed to you? No. And I asked him, what dose was he taking? And it was a very large dose, and he had been with that for a very long time. So for such cases, you do not begin to treat the seizures. You want to get him off the medication that is causing the seizures. That's just an example of that. So, and then after pharmaceutical opioids, then you have the third one here is cough syrup. Cough syrup is also very commonly used in the environment. Benylin with codeine. That contains, they take a lot of it, and the codeine in it eventually makes them to become addictive. Next slide, please. So what are the things that will cause an individual to use substance? I've already said it has a mental component to it. You can't be entirely normal to continue to do something that is very destructive to your life. So, researchers have found that about 40 to 60% of this group of people do have a genetic abnormality. That means you have something in your genes, an abnormality in your genes that will predispose you to the use of these drugs. Now, it's possible to have this abnormality in your genes and you do not eventually manifest substance use disorders. Apart from the genetic component, you now have additional environmental, social, and psychological aspects of it. For example, you have a young child or a young adult who has the genetic predisposition to substance use disorder, and you have another one. The first one is brought up in a lovely environment, family support, there's no troubles at home, emotionally stable. And then you have the other one who has issues at home. The parents are not always there for him. If they are around, they're always fighting. There's violence in the house and all of that. So the one that has environmental issues would eventually develop substance use disorder when compared to the other one who is in a more stable environment. So the genetic predisposition is there, and then this may be enhanced by other psychosocial factors. So, other risk factors, we call them risk factors, that can push somebody with a genetic predisposition include favorable parental attitudes towards the behavior. You see your children, for example, a young adult who is smoking, and you just tell him, oh, smoking is not good for you, don't smoke. These children are smarter than we are. You have to follow them up. You have to ensure that they are not doing things that you are telling them not to do. Poor parental monitoring. These children have to be monitored very closely in and out of the house. You should have a very close relationship with your children. A lot of us just feel that if you're able to provide a roof over your child's head, you're able to feed them, you're able to pay their school fees, that's all about it to bring up children, but that's not so. You need to have a very close relationship with them. They should be able to come to you when they are distressed for any reason on earth. A lady should be able to go and tell his mom, I'm pregnant. That's how close the relationship should be, so that they don't do other things and go the wrong way. If a parent, of course, is using substance, what do you expect of the child? Parental substance use, negative parental influence, if the parents are not behaving appropriately, adverse life events, loss of a loved one or a parent can make a child want to seek happiness elsewhere, and they may turn into substance use. Most importantly, loss of maternal attachment. The role of a mother in a child's life cannot be quantified. Bereavement, association with delinquent or substance-using pairs. The adage, show me your friends and I'll tell you who you are. When you mix up with people who are using substance, it's only a matter of time that you start using substance yourself. That's called peer pressure. Next slide, please. Next slide. A large family size. Yes, studies have shown that people with large family size would tend to go the other way. And this is because the children are so many, the parents do not even have time to focus on all of them, follow them up at the same time, and take care of them. Family discordance, troubles in the family, low family cohesion, the family is not together, the family is not close, the mother is doing one thing, the father is doing the other one, the children have gone out, nobody knows where they have gone to. You should follow up your children and ensure you know what they are doing. Economic stress, of course, what's going on in the country today, things are very, very hard. There's poverty everywhere. Yes, I once had a young man, 21-year-old, he was brought to the hospital, he was having convulsions as usual, and the question was, he was on drugs as well. I can't remember what he was taking. He called it one funny name, whether hashish or something, but he was on drugs and he was having convulsions. So he was brought to the hospital, and I asked him, why do you do these things? And he told me that he was very unhappy and that he was seeing the way his life was going. From the age of 11, he had to start taking care of himself. The age of 11, his mother had many children and did not bother whether they were being fed or not. So from age 11, he was in a work site where he was working, and he just noticed that things were not getting okay for him. He wasn't going to school, he was just working, and the little money he was making was even not enough to take care of himself. So that pushed him to start taking the drugs. And he mentioned to me that whenever he took the drugs, he felt very, very happy. But the happiness is only temporary. So those are the things our children are going through. And that's one of the things that pushes our children into substance abuse. Low academic achievement, childhood sexual abuse. This is another big one. Unfortunately, children are being abused, little children, even those below the age of 10 years old. And they are abused mostly by close family relations, unfortunately. So we need to monitor our children and be sure they are kept in the care of those who would not abuse them. Other mental health issues, other kinds of psychiatric issues can also cause substance use disorder. Next slide, please. So we talk about the stages of the use. Usually it starts with experimentation. A young man is curious about what this is all about. Like I said, this is usually during peer pressure. A young man in uni, going to uni boarding house for the very first time. So they go to party on the weekend. If he doesn't go to the party, he will be seen as not belonging to the group. So he goes and they are smoking, and he just has to try it so that he would belong, with his colleagues. So he starts with that, and he does it every weekend when they go to the club. And then after a while, during the week, he wants to use it again. That stage 2, regular use. So it's not only when they go out now. He starts to use it regularly. And then 3 is risky use. He's using it. It's affecting his health. If he's doing cannabis, for example, he's having respiratory infection, he's coughing, he's not feeling very well. But he continues to use it until he gets to the stage of dependence where he can't even function without the use of whatever substance he's using. And he continues to crave for it. And then the level of addiction is where the mental component is associated with the dependence. For dependence, you have other health-related issues, other organs of the body are affected, but addiction has to do with the brain alone. So you say somebody is addicted to a substance when it's beginning to affect the mental health. What are the signs that someone is addicted to substance? You feel that you have to use the drug regularly on a daily basis and sometimes even several times a day. There is the intense urge for the drug to be used, so much that if you are in school or you are even at work, you can't think properly. All you want to do is to use the substance. And you make sure you have a regular supply of the drug. The drug is always with you, in your bag, in your pocket, in your wardrobe. You always have it. Even if you can't afford to use the drug, you spend all the money that you have. You prefer not to eat, but to save your money to procure the substance. Whilst doing this, you are not meeting your obligations at work. You are not going to school. You are isolating yourself from family and friends. It's causing problems in your life, both physical and psychological, but you continue to use it. You don't have enough money to buy it. You've exhausted your feeding money, and then you start to sell your personal stuff. You're selling your stuff to get the drugs. You're stealing money from your friends and colleagues to be able to get the drugs. Sometimes, before we get to the stage of addiction, they may want to withdraw and discontinue, but usually that's very difficult. And they just continue. At this stage, they may have what we call the withdrawal symptoms. How do you recognize withdrawal symptoms in someone? Next slide, please. Next slide. So we get to substance use and mental health, and this is what I call the stage of addiction. Next slide, please. This slide shows the brain in the middle. You can see they're wrapped in barbed wire. That's what substances do to the brain. Holds your brain captive, wraps your brain in barbed wire. You're unable to think, you're unable to function, and you're unable to do anything. Usually, what the substance do is to make you feel very high. Normally, when individuals are with their loved ones or they are doing something that they like or even eating a meal that they like, there's a pleasure center in the brain which is activated. You also have a hormone that we call the happy hormone. This is released when you are doing pleasurable things. But when substances are used, this happy hormone is released in 1,000-fold. So what they feel is intense happiness, intense pleasure, but the effect of that chemical in 1,000-fold continues to damage the brain, such that you begin to have both functional and structural changes in the brain over time. The brain is being destroyed very, very slowly. And the so-called feeling of happiness and intense pleasure only lasts for a very few hours. So going to withdrawal, what are the withdrawal symptoms that may be noticed in someone who is on drugs? People who use drugs are usually very, very irritable. They are very, very irritable. They are always easily prone to fights. They are very destructive and easily prone to violence. Sometimes you are driving, you see somebody else driving, and the person is just driving like an abnormal person, and you are wondering what's wrong with this person. You're not sure if the person is on drugs. So when you are even driving, somebody maybe tries to brush you off the road, you should have it at the back of your mind that that person is not normal. So you don't begin to drag the road with such a person. You just step aside and let the person just go on its own. Such people are very irritable, violence prone. Their eyes are always red. So when you see those kind of people, you know they are on something. Redness of the eyes is one of them. And apart from all of these, they have trouble sleeping. They are unable to sleep. They have tremors. They're always shaking. They are restless. They are sweaty. They may have cold shakes. Inside of them, they may have bone pains. They may vomit continuously. They may have diarrhea continuously. They may have mood swings, and they may develop high-grade fever. So management of substance abuse disorders and addiction is very important and should be taken very seriously. It is something that is not easy to manage and should be left to the hands of professionals who are trained to manage such. Depending on the stage and depending on the substance that is being abused, some may require just psychological counseling, okay? But some others may require, especially when they get to the stage of addiction and they have withdrawal symptoms. Those withdrawal symptoms can be life-threatening. You may die from withdrawal symptoms. So those ones should ideally be managed in a hospital setting by the specialist. So management involves also detoxification. They want to detoxify. They want to rid the individual's body of the specified drug that is causing the symptoms. And then they are usually involved in several counseling sessions, behavioral therapies, like we have in the counseling section that was discussed with us today. So you must, in addition, adopt a stress reduction regime. You must exercise regularly. That also helps. And you must manage your schedule. You don't want to mix up with peers or people who have pushed you into the current condition. You can get busy doing religious activities. You can come to church to do other stuff. And you must have regular support group meetings. Next slide, please. Say no to drugs. Thank you very much. Do we take the questions after everything or after everything? Okay. So I'll go next to depression. What is depression? Depression is an intense feeling of sadness. Intense feeling of sadness that is persistent, is there on most times of the day, most days of the week, and continuously for over 2 weeks. It's also associated with loss of interest or pleasure, feeling of guilt or low self-worth, disturbed sleep or appetite, low energy and poor concentration. Now, depression is a word we use very loosely, and that's not supposed to be so. People will say, oh, I was in traffic today for 4 hours and I'm just depressed. It was very stressful. You are not depressed, you are sad. There's a difference between sadness and depression. Depression is a diagnosis, and it can only be made by a specialist. So, instead of using the word depressed, just say you are sad. So, what's the difference between sadness and depression? Sadness is a natural emotional state. I'm sure all of us are sad with the state of the country. But depression is a mental health disorder. Sadness is temporary and will pass with time. Sometimes when something stresses you or you are not happy with something, you are sad. But you will notice that with time, maybe you are sad the whole of today, but by the next day you feel a bit better, and then you continue to feel better with every passing day. In depression, you do not get better. You remain the same, or you continue to get worse. So it's a persistent feeling of sadness, hopelessness, and worthlessness. Sadness is usually triggered by a specific event, but depression has many possible causes. Depression may also not have a cause. You may just be depressed without any reason. We'll talk about that later. So when you are sad, it usually does not affect your work. You are sad, but you wake up the next morning and you go to work and you're able to do your work and close the next day. But when you are depressed, your brain is unable to function. You're not able to do anything. Sadness can resolve on its own, but depression would require professional treatment. So, overview of depression. Depression is quite common. In 2023, just last year, The World Health Organization declared that there are over 280 million people worldwide with depression. And the countries that they found that had the highest depression rates were Greenland, Greece, Spain, Portugal, Palestine, and Tunisia, surprisingly. It doesn't leave us out, though. They also found that women are more likely to be depressed than men. And by the age, they also found that individuals between the ages of 18 and 24 had the highest rate of depression. So our youth again. In Nigeria, WHO estimates that 20% of us have depression. That means 1 in every 5 person in Nigeria has depression. And in fact, Nigeria has one of the highest rates of depression in Africa. So depression is very prevalent with us here. The types of depression, there are different types of depression. As shown in this slide, you have those that we call the endogenous. Endogenous depression, there's no cause for it. And those are the people who have very bad depression. They are very difficult to manage. And those are the ones that are very, very prone to suicide. You saw the last few slides where it was shown that some even Western countries had very high rates of depression. So in those people, they are not depressed because they don't have food to eat. They are not depressed because their country is messed up, but they are depressed because they are just depressed. There's no reason for their depression. That's why in those parts of the world, sometimes you have a very rich man who is comfortable, has everything in the world. He goes to the top of a building and just jumps down. And you wonder, why would a rich man who is so comfortable, take his life? So there are other types of depression. We call them reactive depression. Okay? Bipolar disorder is one of those types in which you have somebody who is depressed this minute, and the next person, the person is psychotic and behaving, he's happy, he's up and about, making comments, but the depressed, in the next minute, he's quiet and withdrawn and not able to do anything. We have the seasonal affective disorder. This occurs in the Western world where they have a lot of winter. Patients are found to have depression during the months of winter, and during the summer months, they no longer have the depression. More relevant to us here, we have what we call postpartum depression. Depression that happens with a woman who has just had a baby. That is a bit common in this environment, and the cause is usually the imbalance of pregnancy hormone at that time. It can also be caused if a woman has had a very difficult labor. And then it's also found in those women who have relationship issues with their husbands. Maybe they've had like 4 girls, and the husband wants a son, and she has a baby, and the baby is a girl. And then there's also depression that occurs during the premenstrual period. Around the period of menstruation, depression can also occur. We call that the premenstrual dysphoric disorder. After the period has gone. Now, what causes depression? Just like substance abuse, there's a baseline biologic problem. There's a genetic problem which can now be associated with environmental and psychosocial factors. All of those I discussed before. So there's a genetic susceptibility to develop depression, and the patient will manifest the depression if there are other psychosocial or societal factors that would push out the symptoms of depression. Next slide. So apart from the biological factor, the genetic predisposition, psychological factors include negative parental influence, separation or loss of maternal attachment, the personality types. There are certain kinds of people who have low self-esteem, and they easily crumble under stress. Those ones are easily prone to depression. Socioeconomic factors, poverty, low literacy, modernization, urbanization. You're moving from Nigeria to somewhere like Greenland, where there's always winter. You're not used to sunshine. That can lead to depression. Distressing social relationships, especially in our youth. You've seen girls who would pour kerosene on themselves because their boyfriends are cheating on them and they end their lives. Domestic violence in marital couple, natural disasters. COVID is an example. During COVID, it was reported by research that about 40, the rate of depression increased by 40% during the period of COVID. And then lastly, you have cultural factors, religion. There are religions aside of Christianity and Islam where they have all sorts of doctrines that are not very good, beliefs and attitudes that can push people into depression. So what are the signs and symptoms of depression? How do you know if someone has depression? Persistent feeling of sadness. The person is never happy. He's always looking very gloomy. He's no longer interested in the activities that he used to do. He used to like to go to church. He used to like to go swimming, playing football, lose interest in all of that, and they're just indoors, not wanting to go out, not wanting to relate with anybody or talk to anybody. Sometimes they eat too much. Sometimes they don't eat at all. They have trouble sleeping, or they are always sleeping too much. They are unable to think clearly or quickly. They are easily fatigued, irritable, frustrated, ready to fight, body pains, and in the very bad cases, they do have thoughts of suicide. Treatment for depression, just like substance use disorders, should be by a trained specialist, a mental health physician, and usually involves a lot of psychotherapy and sometimes hospitalization, medications as well. So how to cope with anger when you are depressed? You need to stand up to your inner critic. You must be able to fight. You must determine to fight for yourself. You must be ready to do anything that it takes for you to get better. You can help yourself by get an exercise book and begin to jot down how you feel. Just keep on writing. That really helps a lot. It unburdens your heart, and you can show your writings to your doctor. You must note your triggers and try to avoid them. Breathing exercises, relaxation therapies like yoga. You must reach out to your support system. In this environment, the support system is usually the church, where you get counseling and support. You get people to talk to. You get people to help you with whatever problem that you have. And you should also consider therapy. The last slide, please. And of course, when we are feeling so overwhelmed, God has made promises that would help lighten all heavy load, be it mental, emotional, or physical. And those promises are made in the verses that are showing on the screen. Thank you very much.
Good morning, church. Thank you so much, Prof, for this session. If we have questions, we're going to take physical questions. That's people that will just ask their questions directly. But you can choose to write your question as well. We take it and read it. Then if you are watching online, you can put your question on the comment section so that we can take your questions and Prof will answer those questions. So do you have anyone with a question from the ministers? Let's start with the ministers, please. Okay, mic to Pastor Damola. Before you ask, Prof, do you want all the questions and you answer, or you want to answer
one after the other?
One after the other. Okay, Prof.
Good morning. Thank you so much for this insightful slides. A question and a comment and an advice as well. Okay, so we have a lot of, I'll start with the advice. We have a lot of young people that attend parties, and they're not going there with the intention to take drugs. So you need to test things that are being handed out to you. A drink, find out the source of the drink, and also people hand out cookies and cakes that they've put weeds and things like that now. So you need to be mindful of what you're consuming. by also praying before you consume any matter. One thing I wanted to ask is, there was a pictorial view of your brain being locked based on substance. Can sugar also be an addiction that will lock your brain like that?
Sugar is not in the list of addictive drugs.
Okay.
Sugar is not in the list of substance.
So it can't affect your brain.
We're talking about something else entirely. When your blood sugar is too high, in people who have diabetes, it causes brain damage, but in another way. But sugar is not a substance. You don't get addicted to sugar, okay? But very high levels of sugar and very low levels of sugar can destroy the brain.
While we wait for Pastor Tesh's question, I want to read this question. It's from one of the ministers as well. It says, what factor can trigger a relapse after treatment and the person is seemingly fine? What can cause a relapse after treatment?
Like I said, it's very addictive, okay? Over time, there's a change in the constituents and structure of the brain. If there's a relapse, it's very likely that initial treatment was not adequate. Medications, even if the medications are stopped, counseling needs to continue for a very long time. If you do not finish your treatment, then you may have a relapse.
Thank you, Prof. Pastor
That's why I
Tesh,
also said that the psychotherapy should be by people who are experienced in such, because they do a lot of stuff, cognitive behavioral therapy and all of that. It's really highly specialized. It's not just talking to you and say, oh, don't use drugs, don't do this, don't do that. It's really professional.
Okay. Thank you, Prof. Pastor Tesh, please, your question.
Treatment. They are taking drugs, do they have to be on those drugs for life?
What do you mean? Let's start with one.
A young person who has a mental breakdown
okay.
due to the use of taking drugs.
Okay.
So he was taken to a psychiatric doctor. Yeah, they prescribed drugs for him. He's been taking the drugs. And also an elderly person who went into depression during COVID, who had a mental breakdown, was taken to a psychiatric doctor, placed on drugs. So I'm saying those two.
Okay.
Do they have to be on that psychiatric drug treatment for life?
Okay. Starting with the first question, it depends on the type of substance that was used. You really cannot compare somebody who has been taking nicotine, for example, with somebody who has been taking crack cocaine. So there are some of those substances that are more addictive than others, and it also depends on the length of use. The truth is, you may get to a stage where there's no turning back. Cannot be reversed. If a patient has been on a drug for a very long time, okay, there may be no reversal, especially if the person has a genetic predisposition. There are I have seen people, elderly men, who have been on cannabis since they were in their youth. And they are 75, and they smoke cannabis every day, and they are fine. They have never had a mental breakdown. But then you see somebody else who smokes 2 wraps of cannabis, and is rushed to the hospital. So patients are taken on a one-on-one basis. It depends on the length of use, the type of substance. Does that person have a genetic predisposition, and all of that? That would determine if the person will be on treatment for life. Now, the other one, depression, is easily treatable and reversible. It also depends on the type of depression. Like I said, there are more severe types where, despite all the treatments, any small opportunity, that person just wants to go and commit suicide. There are some of them like that. But there are other types that are reactive, meaning the depression is caused by something, and then when the trigger is removed, then they can be managed. Does that answer your question? Are you okay? Are you sure? I don't think so. You can ask again. I don't. Okay, all right.
Okay, thank you, Prof. We want to take questions from the teenagers. So if we have questions, please. Michael.
My first question is, why is it, this is about the first topic that they taught, drug abuse or substance disorder. Why is it that when a person is free from substance disorder, they normally get stigmatized or felt out of the group? Like they take them as another person, like an outcast, yes.
Why do they do that? That's society, and that's actually very wrong. Like I said, these are people that we should have pity on, and we should love them and help them and support them. So stigmatization by society is very bad. It's very common in other medical conditions as well, but it's not good.
Secondly, why does depression lead to mental issues or madness?
I won't use the word madness. Mental issues. Depression itself is a mental health disorder. Okay? What happens is that you have a reduction in some neurochemicals in the brain, and that person is unable to function optimally. You are not listening to me. Did I answer your question?
Okay, William, ask your question.
Does depression lead to suicide?
Yes, it does. Some of them, not all of them.
Questions from
Some
the teenagers?
types.
Any question? Okay, let me read this question while we will come back to you, sir. Okay, this question says, for teenagers who have a hard time interacting with people, even their parents, and can't share their problems, and can't go for counseling, how can they overcome depression?
You have to talk. If you don't talk, nobody can help you. Because if you're not speaking out, nobody can know what's wrong with you. So you have to, in yourself, try and help yourself. If you don't speak out, if, for example, you don't tell me you are hungry, nobody will know you are hungry. You can be frowning your face, but you can have pain, you can be hungry, you can have a headache. So if you don't say what it is exactly that is wrong with you, nobody will be able to help.
Thank you, Prof. Let's take his question now.
Thank you so much. I have a question. So let me ask the question first. Is it possible for parental abuse to cause depression in teenagers and children? That's my first question. And number two is a comment. In my former parish, 2022, we lost a boy. He was in the university. I won't mention the university because of. So he's never taken drugs before in his life. He was like 16 when he did admission. It's one of these top universities in Nigeria. And what led to his death was drugs. When he gave admission,
What kind of drug?
he was taking all kinds of drugs. Cocaine, tramadol, name it. That's why I want to take time to explain. So, and because of the youth that are here, when he gave admission, he was 16 years old. And he had worked in my office before. And I knew he was never somebody that took drugs. So, but they put him in a room where there are senior students, adults, much older than him, and they were taking drugs in that room. So he was introduced. How we got to know that he was on drugs, his mother didn't even know. Goes back to what you said, having relationships with children. The mother travels a lot to
UK, US, business, and doesn't really stay much at home. So by the time we discovered it was during graduation, he was supposed to be among those graduates. And we discovered it was the last one took his exam in year 2.
So the parents were not acting for the results.
This is my comment I want to make. Just what you said earlier, parents must monitor. But more than monitoring, you must become friends with your children. If you are not friendly with them, they are going to outsmart you. If you don't make friends with them, they can tell you anything, that they are not afraid of you. They shouldn't be afraid of you. They should love you enough to be able to tell you what they're going through. We buried that boy. That was one of the saddest cases in my life and passing as a pastor. And the mother later discovered that they had been on drugs from year 1. So I just want to make this comment to say that as parents, if we keep putting fear in our children, they are going to go out. They won't tell us the truth. But if we show them love, let them trust us, that we can help them, they're going to come out to tell us the truth. Because I asked the boy eventually, why didn't you tell your mom? Why didn't you tell me? He said he was afraid, just like that young man said. He'll be stigmatized. Nobody wants to associate with him. And the father and the mother, they take it in different way. But we found out too late. And he died. So I want you to throw more light on that, especially because of the youth that are here and we parents. So my first question was, can parental abuse lead to depression in young people, especially children? Thank you.
Thank you for the question.
Thank you for that question. Prof.
Definitely parental abuse can lead to that. But it depends on what we mean by abuse. I mean, chastising your child, using the cane sometimes is not abuse. But there are some people who would just go out of their way to want to bring down their children morally for one thing or the other. And before I go on to add to what you just said, I'll just quickly throw some lights on depression again. Depression can occur in children who are even less than 10 years old, and the way they manifest will be different from that of a teenager or even that of a parent and a full-grown adult. In children, when you see a 5-year-old who is very defiant, not listening, you say they are very stubborn, okay? He's not ready to go. He doesn't want to study. Or a teenager who doesn't want to go to school. They are very troublesome. They are not just very troublesome. Something is wrong somewhere. They could be depressed. And such children should be taken to a doctor, a mental health physician. I've seen young children, 5, 6-year-old, one of recent. It was just a patient. I was seeing the father and he was complaining about his child. And I said, take this child to 6-year-old, very stubborn. He doesn't listen in the house. Nothing they will do. They keep on beating and beating and beating him. But when he got to the mental health physician, he had a diagnosis. So these things do occur, and we should know. Teenagers will not want to go to school. You know, they're stubborn in the house. You give them instructions. They don't listen. Send them somewhere. They do what they want to do. You should look very closely and seek help for them as well. Back to the case scenario. It's very sad because I, for one, cannot understand why I will send my child to a school and at the end of the year, I'm not seeing results. How would you pay school fees and at the end of the year, even if you're not going to school to check on the child, at the end of the year, you want to see results? Your child is not bringing results to you. And what excuse is the child telling you for not bringing results? First year, second year, third year. Fourth year, you are now seeing that the child had not been in school for 2 years. That's the highest level of irresponsibility on those parents, I'm sorry to say. And it's not all on the mother alone, the father inclusive. It's not only the mother that gave birth to a child. The father must be there and should also be seen to be responsible. So you must really be close. You must give them surprises. Your child is in boarding school. You don't wait for maybe visiting day. You must have a relationship with somebody in that school who is monitoring your child. Your child, for me, the child will not even know that I know somebody there. So I'm getting reports from somebody they don't even know. Because if they know the person that will be reporting them, they will be avoiding the person. Our children are smarter than us. They are very, very smart. So you should become a police if you don't want to cry over your child. That is very, very important.
Thank you, Prof. Let me read these questions. This one say, how do you help a close family person who is addicted to alcohol?
Take the person to a doctor. There's alcohol abuse disorder. They will be seen by mental health physicians. They will undergo counseling sessions. They have all sorts they do to them. That's an addiction and requires treatment.
Thank you. This question says, what can one do to get back to yourself as in what you love to do and all after childbirth? What can one do to get back to yourself as in what you love to do and all after childbirth? As it can be very overwhelming. What can you also do when you discover you keep to yourself so much?
Is that person talking about postpartum depression?
I think so. Postpartum, yes.
Postpartum depression requires treatment. See a mental health physician. They will ask you questions. They may be able to determine what is causing the depression, like I mentioned before. Maybe it's your husband who is telling you you must have a male child, and you must have that by fire, by force. Or you have a problem in your relationship. Is it a difficult labor? For a difficult labor, you could go through counseling, and that helps even without medication. And if there's no cause for it, they would assess you as well, put you on medication and counseling. That's just it.
Thank you, Prof. This question says, what is the difference between depression, mental breakdown, and schizophrenia in someone who does not take substances but just depressed, placed on medication for life, relapse when not on medication?
Okay. Depression is a mental health condition that is totally different from substance use disorder. A depressed person can begin to use substance, and substance use disorder can lead to depression. For schizophrenia, that's another type of mental health condition, okay, that is managed with drugs. Mostly they're on drugs for life, and if they stop taking their medications, they may have a relapse. Yeah.
There's this question that says, please, ma'am, you spoke about eye redness. Eye redness is as a result of substance, but I don't drink nor smoke, but I have a red eye. I went for a test. I was told it's allergic eye congestion. I was given medication, but the redness still continues. What is the permanent solution to allergic eye congestion?
It's not only substance use that will cause. If you have Apollo, your eyes will be red. So if you have some redness of your eye, you see an eye specialist. I'm not sure if allergic eye condition will cause redness. It may cause itching and watering. I'm not sure about redness. So see the eye doctor. I can't say more than that.
Question online. It says, are there tips that a depressed person or people around them could adopt to effectively help? Tips aside medical treatment, which may be another difficult hurdle for a depressed person.
What do you mean difficult hurdle?
Well, I don't understand. It said, are there tips a depressed person or people around them could adopt to effectively help? And he's trying to say these tips should be aside medical treatment, which may be another hurdle for a depressed person. Maybe the person does not want to be...
Doesn't want to consult a
Yes, maybe
physician.
because of stigma and the rest of that.
You better put stigma aside and see a doctor. There's nothing anybody around you can do to help.
This question says, how do you know if someone is depressed? Then, why do people get depressed?
How do you know if someone is depressed? I said all of that. The person is sad, all the time, for most hours of the day, most days of the week, persistently for about 2 weeks, and it's not getting better. And I compare that with sadness. Did I answer the question? Was that your question, ma? Yes. Her question. She was raising her hand. Okay.
Grandma first. So, Grandma, please.
Good morning, church. Please, doctor, can depression come as a result of overwork? That is somebody who works, he works in the day, the night, midnight, no rest. Can that cause depression?
No, ma.
Okay, last question from Mommy Arugodon.
Okay, so I want to find out something. So is it true that if you introduce your children early to a lot of sporting activities and extracurricular through their early stages to teenage, they have a tendency not to be involved in those things? So I have a nephew and a wife who live abroad. From when their children are very young, when they close from school, they take them for football, running, they take them to countries to go and play. So I asked them, they are both doctors. Isn't this too much? And the wife said to me that part of the reason why they do it is because when you engage children a lot in extracurricular and sporting activities, they have a lower tendency of doing drugs. Is it true?
True.
But we don't have such facilities in Nigeria too. Where if you pick your children from school, there's a football place where you can take them, they do game, they travel to other cities to go and play matches. So maybe if I don't know how.
It reduces the incidence, but it does not completely rule it out. Because even those who do sports have what they use. They do have their own things that they do too. They do steroids, they do drugs as well. So it doesn't totally rule it out.
Thank you so much, Prof. So that's the last question. Can we just all stand and stretch our hands towards Prof and pray for her? I think Prof have done a wonderful delivery. So can you just stand and just bless her for this talk? Bless her that God have used her for his people today. That which God have done through her will bring seeds, and also her life will be replenished. She took out time. She's a very busy person, traveling within the country, outside the country. She made that time to be here with us. So let us pray that her labor of love also God will reward her. Father, we thank you for your daughter, Professor Oshinaike. We pray, oh God, that you will multiply grace unto her. You will keep her standing in the name of the Lord Jesus. You will sustain her in all her travels. You will help her to even ascend even to greater levels in the name of the Lord Jesus. You will bless her continually in the name of the Lord Jesus. Thank you, Father. In Jesus' name we have prayed. Thank you so much, Prof. Please, can we just give her a resounding round of applause? Thank you, Prof. Thank you so much. God bless you, man. Keep clapping till she gets to her seat. Keep clapping. Thank you so much. All right. Thank you.